pain, not eating, vomiting, sometimes diarrhea, infectious microorganisms that are implicated in the pathogenesis of the disease.
Pancreatitis. Probably the only term that's harder to spell than diarrhea is pancreatitis. Lots of vowels in there. I guess we'll start with the obvious question. What is pancreatitis?
Great question, Mike. Essentially, it's when the pancreas, which is this little L-shaped organ in the abdomen, becomes inflamed. It can lead to a lot of bad downstream effects and lead to a lot of symptoms in dogs and cats and people. And yeah, just I guess for those people who are interested, pancreas has a lot of different functions. It has a lot of different components, and there's like the endocrine portion and then the exocrine portion. And different cells in the different tissue of the pancreas are going to produce some enzymes that get released into the intestines to digest carbohydrates and fats. And then there's the hormones. Think of like insulin, probably the most famous one, that will be directly released into the bloodstream. That's going to be regulating blood sugar levels. And so those are like really some of the basic major functions of the pancreas. So what can sometimes happen, pancreatitis, is when some of those enzymes that are supposed to get released into the specific portion of the small intestine, hit up all the food that's been eaten, they usually get released there. But if they get released early, prior to making it that far, it can kind of start digesting the pancreas itself, actually, and lead to a lot of inflammation and a lot of clinical signs and symptoms that owners will notice before they know, or they won't just know, oh, pancreatitis. They're going to be seeing all sorts of clinical signs at home that bring their dog to the vet.
And let's get into those. What are the symptoms? What should people be looking for?
So the big ones are vomiting, inappetence, abdominal pain, ain't doing right, lethargic, and then fever would be really some of the main ones that we're looking out for. In people, like 90% of people who have pancreatitis are going to be complaining of like abdominal pain, especially on their right side. And it's not as high in dogs, but I would venture to guess it might not be clinically detected, like when a vet will be palpating the abdomen. But generally, it's a really painful diagnosis. So pain, not eating, vomiting, sometimes diarrhea, sometimes bloody diarrhea. Those are the big ones to look out for. And it's one of those things that can often be grouped in with other sort of gastrointestinal problems. So when a dog presents for this stuff, you may not know, a clinician can't know for certain, really without pancreatic biopsy for sure that it's pancreatitis, but you have a strong clinical impression. And certain things that it can, be thought to be as differential diagnoses would be like a foreign body obstruction or gastritis, so inflammation of the stomach. Those are kind of the big ones. Yeah.
Okay, we'll let people know who are watching. If you wanted to ask a question tonight, it doesn't have to be about pancreatitis. It could be about anything vet related or general trivia. It's fine. I'm good at geography or movies. But you can go to the Rockwell Pets Pro Ask Our Vet page and register there, and you can ask questions. They'll show up here on my screen, and we'll throw them up as they come in. So you've got a dog, you think it has pancreatitis. How can you differentiate that between, what are some of the diagnostics you do between that and just upset tummy?
Absolutely. So in terms of diagnostics, I think the first things that like probably 90% of vets would be recommending to the owner would be pulling blood, doing a CBC, complete blood count, chemistry profile, and what I would put on that additional blood test would be something called a PLI or CPL, canine pancreatic lipase immunoreactivity, which is a mouthful talking about so many syllables. But that's the enzyme that we're really looking for, that it's very sensitive or specific to pancreatitis. So whereas, a dog who may have inflammation elsewhere in the body or in the gastrointestinal tract, if you run this CPL and it's not high, it'll tell you a specific value. I actually don't remember the 0 to 300, maybe normal, and then above that would be I don't know. I really
don't have it memorized.
No. But essentially, that's going to be the one that will be the ticket to effectively rule in or out pancreatitis. That's kind of the gold standard when it comes to blood work that can be done to rule it out. And then additionally, you might find an elevated white cell count on the CBC. Usually, though, that I think maybe in previous iterations of our little podcast show, we've talked about elevated white cell count, what that means. Really, it's just an inflammatory process going on, which pancreatitis is. But this is kind of different from, an infectious one, especially bacterial, insofar as, this is a sterile process. There really aren't bacteria or any infectious microorganisms that are implicated in the pathogenesis of the disease. And therefore, like, antibiotics you would not treat this with antibiotics. So even though a lot of times you may see a white cell count and someone may think, oh, we jumped to, doing some sort of antibiotic, that's not really, pancreatitis in dogs or cats will not really respond to that. But yeah, those are some of the diagnostics that I would, be recommending for a dog who came to me with those symptoms we talked about. Additionally, like, x-rays can be done, but they usually won't be able to show the pancreas. It's a pretty small organ in the grand scheme of things. Liver's way, way bigger. Stomach, like, these things are going to be more visible on x-rays. The imaging that would be able to show it better would be abdominal ultrasound, which we don't have in our clinic, at all times. We have an ultrasonographer who comes in and does that imaging like once a week usually. But, so not all clinics have the luxury of doing that. But abdominal ultrasound would probably be able to show some changes to the pancreas.
Hey, if you like this video, don't forget to like and subscribe to the channel and share it with all your animal-loving friends. My name is Mike the Voice Monkey, and we will see you this week with Dr. Max on Ask Our Vet.